Hey, good morning. It is First Cup with First News, and each week we go live from a different location across the Arklatex. Willis, Knighton is where we're at this morning. Dr. Abagun is joining us, neurology. It is Stroke Awareness Month, too. And with all of that said, welcome. Thank you for being with us this morning.
Happy to be here.
Yeah, we are too. A little early, but we're going to jump on through this right now. So I want to ask you one question. What does it mean when someone says to you they've had a stroke, or they think they've had a stroke?
Yeah, so like we all know, stroke is a medical emergency. And when somebody says that they've had a stroke, it really means that one of the arteries that take blood to that part of the brain has been blocked, and that has caused that part to be damaged. So is it blocked or the artery is ruptured? So we have two types of stroke. So the first one is from blockage, maybe a blood clot, just blocking the flow of blood to that part of the brain,
right,
causing that damage. And then the second one is like maybe a rupture, the blood vessel just rupture and there's blood everywhere in the brain. And that's the bleeding type of stroke.
And with strokes too, they're really hard to, you could have had one and not know it.
Right.
So they're so subtle that it may take you going to the doctor to find out, hey, how's my heart? Have I had a stroke just by chance?
So one thing we should keep in mind is that stroke happens all of a sudden. So you just feel that sudden onset change in something. You either all of a sudden feel numb on one side or just feel weak. We usually have this acronym that we use to help people remember when they've had any of the symptoms. It's called BFAST, B-E-F-A-S-T. The B stands for balance. So if all of a sudden you can't stand or you're swaying away to one side, that means there's something happening. And then the E stands for your eyes. If all of a sudden you're blurry vision or double vision or blindness in one eye or both, that's also concerning. The F is the face, where you just all of a sudden feels like your face is numb or droopy, like on Acor. When you try to smile, it's not balanced. And then the A is the arm, where your arm's kind of numb or is just drift when you lift it up like this. It's like one side is falling down.
Okay.
Yeah, and then the speech is the S, and people just get slurred speech and you can get the words out. It's also very concerning. And then last and not least is T, which just basically stands for time, meaning that you have to act fast.
Right.
Yeah.
Yeah, because time is of the essence. And typically I stumble on my words, but that's because I haven't had coffee just yet in the mornings. But I have migraines too, where I don't see anything over here. So I guess there's some gray areas too. I know we're going to jump on out of here. We're going to come back with more a little bit later for Stroke Awareness Month. It is First Cup with First News. Each week we go live from a different location. I'll have your forecast coming up at 4:53. Back to you guys. Stroke Awareness Month. Again, it is something that you need to watch for. Be careful. There are ways to prevent it. Sometimes, though, there are not ways to prevent stroke. And Dr. Abagun joins us again, neurologist over here at Willis, Knighton North. Doctor, so there are ways you can prevent it, or at least I guess help prevent it anyway, but there are also ways where you can't. It might be genetic, maybe?
Right, yeah, correct. So yeah, the ways that we can prevent it are ways that, common conditions that people carry every day, like high blood pressure, diabetes, high cholesterol, and also smoking, bad habits like tobacco smoking, tobacco chewing is also very important. Those are ways that we can actually prevent ourselves by not doing those things. And also inactivity, like living a sedentary lifestyle, and not exercising, and bad diets and stuff like that can also
so those are ways you can prevent it by not doing those things.
Don't do those things.
And the ways you can't prevent it.
Yeah, so these are things that we already have as people. Like age, for example, is something that as we get older, especially greater than 55 years of age, the risk significantly increases. Also family history of stroke and some genetic diseases like blood clots in a family. Previous history of TIA, like a transient ischemic attack, like a stroke that was going to happen that didn't happen, increases the risk as well. And that you can really prevent because you already have something.
If you go to the doctor, can you go to a doctor for a stroke checkup to see if, hey, you might be close, is there anything you can do like that?
So I guess at that point you just have to change your lifestyle and modify some things with your diet and exercise more and just eat healthy.
Okay. All right. Well, there you go. All right. It is Stroke Awareness Month. It is First Cup with First News. We will be back with more coming up, and we will check out that 7-day forecast at about 5:23. Nate, Shannon, the text. All right, first cup with first news. We're being joined this morning by Dr. Sonig. He is director of the Willis Knighton Neurovascular Institute. And Dr. Sonig, thank you for joining us this morning. We appreciate you being here with us.
So nice to have you here.
Yes, you bet. All right, so we've got a question for you here. What interventions are available for patients with strokes, for patients that have had strokes that have been caused by clots?
Correct. So what happens is, when somebody is having a stroke, in literal meaning is that there's a clot that goes into the brain vessel and kind of clogs it, and it prevents the supply of oxygen to the brain cells. So literally, when this happens, the brain cells are dying in terms of millions per minute. So you need to go there and remove the clot. Now one way is by giving a clot busting medications, which most people, they are not eligible for that. And in sometimes, even if you are eligible, it won't work in 25% cases, especially when it is in a bigger vessel. So you have to go literally inside through the vessels of your radial artery, the artery of your hand, or the artery of your leg, the groin artery, and go special devices, catheter, we call it stent retrievers, large bore aspiration catheters, and go in there and pull the clot out. And once the clot comes out, it restores. It's easier to say that way, but it requires special technology, the machine where you do this procedure, and the imaging quality is needed to ensure that the procedure can be done safely. Not everyone is eligible for that procedure.
Okay, all right. And like you said earlier, thousands of brain cells are being killed every
time is brain.
Every minute, yeah.
Time is brain.
Yes. So minutes count when you've had a stroke, and that's why they say call the doctor, don't wait, because things can continue to happen.
And the good thing is that now the trials have come. Initially, it used to be, hey, you have to be within like 3 hours, 6 hours, but we can offer thrombectomy or pull the clot out mechanism in up to 24 hours and beyond in certain cases. So if you're having a stroke, come to Willis Knighton North. That is the center where you can do this thrombectomy for you.
All right, Dr. Sonig, thank you very much. First cup with first news. It is Stroke Awareness Month. We'll have more on your forecast coming up. We're at Willis Knighton North. We're talking about Stroke Awareness Month, and Dr. Sonig, neurosurgeon, joins us. He is the director of Willis Knighton Neurovascular Institute. Thanks for joining us again this morning, sir.
Thank you for having me again here.
We've had a lot to talk about, and on another topic here with regards to strokes, what interventions are available for a stroke that's caused by bleeding?
Yeah. So bleeding in the brain is a very serious event, and sometimes the bleeding can be a big one, which causes increase in the brain pressure. So when that happens, patients become sleepy and drowsy. The only way you can take care of that and you need to open the brain. So basically you will do an open brain surgery in which you cut the skin, take out the bone flap, and then you go inside the brain, take the clot out to save the patient's life. Now, sometimes the bleeding can be small, but the cause of the bleeding is very important. In some patients, you can have a brain aneurysm that can rupture, and these aneurysms are very dangerous. If they rupture, 50% of the patients, they don't even make it to the hospital. They succumb either in their home or on the way. So, and it runs in the families too. So it's very important that if you have some member who has a brain aneurysm, if your family member, go to your nearest doctor and have your brain imaged to find the aneurysm, so that if it ruptures, you can basically be on time to the hospital, or you can basically directly reach out to a neurosurgeon like me who's trained in vascular, so that you can get the results very fast.
And that kind of a clot or aneurysm, you can't detect. You're just walking down the street and all of a sudden you can be gone.
It's like a sitting time bomb in your brain. If you have a family history of aneurysm, it can rupture any time, and when that happens, you become unconscious. Good news is that nowadays there's a much better way of fixing those aneurysms. You can go from a minimal invasive route, like going through your vessels in your hand or legs, up to the brain, and you can put some coils inside the aneurysm. The coils are actually made of a metal hair, which is like smaller than the thickness of your human hair. So that is the kind of technique we are talking about, using that kind of small wires, smaller than the thickness of the human hair, go inside your brain, inside the aneurysm, and clog that.
That's amazing. Medical science these days.
Yep.
Absolutely incredible. Thank you, Dr. Sonic. We
Thank you so
appreciate
much.
you being with us this morning. It is Stroke Awareness Month. It was Dr. Sonic, neurosurgeon, director of Willis, Knighton Neurovascular Institute. First Cup with First News. Each week we go live from a different location across the Arklatex.